Now, one of the things I think I really wanted to chit chat with you about. So let's say we, both of us, have the opportunity right now to talk to Jane Doe on the street. And Jane Doe is probably searching for rhinoplasty surgery. I mean, you can only imagine in today's world, it really is confusing for a patient. If you do a Google search, you're kind of bombarded with information and everyone says, I'm the best. And so what should Jane Doe really be looking for? There's a billion different blogs, but coming straight from the horse's mouth, someone who's done it, and it's almost, you're probably kind of what I'm going to say rhinoplasty royalty, right? I mean, it's almost in this kind of very father-son apprentice type of system. If you could talk to Jane Doe, what would you tell her?
Well, I think there's several things that a patient must have in seeking out someone to perform a rhinoplasty uh, on themselves or on their daughter or
Anybody, a family member.
the point being is number one, they need to be able to be upfront and open with the doctor with a free exchange. That means you cannot go in there with the idea that you're frightened. You want to make sure that you feel comfortable talking to the surgeon. Number two, the surgeon, number one, must listen carefully to the patient. It's not to impose the surgeon's wish, it's to make sure that the surgeon understands the patient's desire.
Absolutely.
And then the last part, or the next part, is to make sure that what the patient wants, the doctor wants. Number two, that what the patient wants and the doctor wants fits the patient. And number three, that physically it can be done. So those four things, patient has to be able to talk openly to the doctor, patient has to be able to express what they want, it has to agree with what the doctor agrees with as well, and the doctor has to say he or she understands what can be done physically. And then after that's there, then it's very important that you're able to sit there and explain to the patient how it's to be done and what the expectations are, being upfront and openly. And to be able to pick the doctor, to go through the Google search is today it's done very easily because anybody can put anything they want. But one of the best things to do is to be able to find out from the doctor, is this a procedure that he does often, many times? And the doctor obviously needs to be honest with her. If the patient really desires, and some patients will come and ask, how many do you do? And I think it's a good thing to tell the patient how often and how many you have done and do, uh, and let them know what your training is.
Hmm.
Now, rhinoplasty happens to be a very cross area of surgeons. For instance, you have general plastic surgeons who perform body work and do the liposuction over the body and the implants and everything else. And then you have the facial plastic surgeon who is trained primarily from the neck up. And the background normally comes in where they've done the multiple internal and external procedures on the nose. So I think it's important that the patients understand the difference between a rhinoplastic facial plastic surgeon and a general plastic surgeon who performs rhinoplasty. And I think that that's a very key part in having a patient look up a surgeon to perform a rhinoplasty. When you do a rhinoplasty, you have to understand there's two factors. There's the outside and there's the inside. And the otolaryngologic or ear, nose, and throat trained facial plastic surgeon has the experience in both sides. So you
Absolutely.
want the nose not only to look good, but you want it to function
Right.
very well.
So
And
some,
so I think those are some of the points that I would want to tell a patient when they were picking a surgeon, how to go about skipping the Google part, but finding out the history and the training specifically of the individual surgeon.
So, a couple of caveats that I'd like to kind of add. So, when patients ask about this, one of the ways that I try to explain it to them is, so let's say your car really needs some major work done on the engine. You have a choice. You can go to the guy at Jiffy Lube who does oil changes to do the engine work, or you can go to a guy who specializes and says, hey, I do engine work and that's it. And so the guy who probably does nothing but engine work from an experience standpoint, from how many times he's done it, it's just not even a comparison. I think I was looking at some data, and this wasn't just for rhinoplasty. This was for many surgical procedures, and they found that the number one factor to minimize complications with a surgical procedure is simply how often does the surgeon do that specific procedure. I mean, it makes perfect sense. I mean, it's just common sense, but sometimes we forget about that. And so I think that that's a very important aspect. So for everyone listening, both Dr. Silver and I are both facial plastic surgeons, and we had very similar training in terms of how we went about getting to where we do. And both of us, our practices are primarily rhinoplasty. We do other stuff. He doesn't do that much other stuff anymore. I still do, but probably 80% of my practice is still rhinoplasty.